I've worked here for 3 years. There are 4 GPs, 2 nurses in the practice. It's fair to say it's a challenge. When you're a receptionist, you're on view the whole time. When patients are waiting to see a doctor, they watch us and they listen. You know, some patients can be really rude to us, especially on the telephone. But they see us as a barrier, preventing them from seeing a doctor. I work in a lift building. There are 3 GPs practices in the one building. Reception can get very busy, hectic really, and the phone is ringing continuously. There's nowhere to go, you know, if you feel like you need to gather yourself just for a couple of minutes, if you start to get a bit stressed. Take the other morning, for example. Monday morning, it was very busy. We were flat out. I mean, it didn't help that Sue, one of the reception staff, was off poorly. So we were really up against it. One of our patients' sons wanted to come in and register with a GP. So he came to the reception desk. When he got to the front of the queue, he said, "I want to register with a GP." I sighed. I must have looked miserable because he said, "You look fed up, love." So I took a deep breath and very politely explained that if he wanted to register with a GP, he'd have to have a new patient health check. He didn't mention that he wanted to see a doctor. After he'd had his health check, he came back to reception. When he got to the front of the queue, he said, "I want to see a doctor, and I want to see one now. I need an appointment today. It's urgent." He was leaning over the desk and shouting. I asked him what the problem was because I needed to determine the urgency. He said, "I need a sick note and I need it today, otherwise I'm going to get in bother with the benefits people." And I told him that a sick note didn't warrant an emergency appointment. But the benefits people would be okay as long as he got an appointment soon. He wasn't having any of it. He was shouting, "What about my benefits?" In the meantime, the queue was building, the phone was ringing, and then his mother chipped in. I could feel my stress levels rising. You know, I felt like giving him an emergency appointment just to keep him quiet. But then what if somebody else came in later that day and really needed that appointment? It's so hard. You know, sometimes I feel that as reception staff, we're at the bottom of the pile. Don't get me wrong, we want to help patients and to ensure that everything runs smoothly. I just wish people would realise that that's not easy.